Hello. On behalf of Fire Chief Greg Paxton and the Columbus Division of Fire, welcome to EMS Perspectives, giving you a glimpse into the world of emergency medical services within the Columbus Division of Fire. I'm Dr. David Keseg, Medical Director of the Columbus Division of Fire, and your host for today's program. Members of the Columbus Division of Fire EMS respond to many contagious emergency calls that put them at risk for being exposed to harmful infectious disease. Believe it or not, one of the most deadly infectious diseases that our EMS providers encounter is none other than the common flu bug. And right now, we're entering the time of flu season, and we want to talk about the flu and you. Now, the flu has another name, and it is also called influenza, after the virus that causes the flu. The influenza virus is highly infectious, and epidemics with this virus have been reported since the 16th century. There have been some major flu pandemics over the years, but the most recent one that affected the United States in a particularly deadly way was the Spanish flu pandemic. This epidemic may have killed as many people worldwide as the bubonic plague. It killed 1 million people a week for the first 25 weeks. There are two major strains of influenza virus, type A and type B. Type A usually causes moderate to severe illness and affects all age groups, whereas type B causes milder epidemics and primarily affects children. 10 to 20% of the population is infected annually with influenza, with 200,000 of these cases being hospitalized, and unfortunately, 36,000 people die each year from the flu. The opposite ends of the spectrum, as far as age, are most likely to be hospitalized or to die, so the very young and the very old. Now, the flu is spread primarily through airborne spread of the virus, and the peak times of onset are usually between December to March, although it can occur earlier or later than this. You are infectious with the flu 1 to 2 days before you even have any symptoms, and then for 4 to 5 days after you become symptomatic. Recently, we had the opportunity to talk to our very own health commissioner for the city of Columbus, Dr. Teresa Long, and ask her some questions about the flu and how we can prevent it. Well, tell us a little bit about what exactly is the flu. What is it?
Well, it's an infection, obviously, that's spread by a virus. Flu and true influenza actually is an illness. It can be a very serious illness. So indeed, we are concerned when someone has any respiratory infection, but flu in specific, true influenza. Often people have a high fever. They may have an infection, respiratory. Again, it's respiratory, so problems with their coughing, sometimes breathing. And again, it really causes, because of the high fever, causes body aches. And so, again, a very serious illness caused by a very specific virus or strain or family of viruses called the influenza virus. And again, it is not, many people are confused, it is not a gastrointestinal infection.
Oh, okay, so it's actually respiratory.
It is a respiratory infection.
Okay, great. So it's not quite like the common cold, though. So if I get the sniffles or something like that, do I have the flu, or how do I know?
Right. Well, how do you know? And in fact, it's not that easy to know when you have true influenza. So indeed, respiratory, that's the first decision. And then it actually has to do with some of these symptoms and how serious they are and how much they hang on. Because again, influenza is a serious infection. Oftentimes may start with cough and chills, but often, and most often, there is a high fever and a loss of energy. It is those kinds of things that let a physician or any kind of healthcare provider know this is more likely to be influenza. Now, most of us probably gut it out at home, but there are some people that we're particularly concerned about. Sometimes the very old, those with chronic conditions, the very young, and people are surprised that children actually are at high risk for influenza and serious infections. These are kids and adults that if they start to get into trouble, they probably are going to seek medical care. They may actually need transport to visit a physician, a hospital, etc. And in fact, right now, in every flu season, we actually have many people who get hospitalized, and there are deaths every year from influenza.
Right, and our EMS providers are called many times on the 911 system to come because people are feeling really sick. They don't know why, so they get transported. Our folks get exposed to the flu. They then expose to other patients that same virus, and so it really promulgates the spread of the influenza virus.
Well, and it's one of the reasons why we really try and protect your EMS providers, all healthcare workers, those of us in public health, and actually the entire community. That's the importance of a flu shot or flu vaccine. There's actually a nasal spray as well, but indeed it is this ability, and influenza, I want to be clear about that. True influenza is very unpredictable, and in fact it's rapidly contagious. It can easily spread, just like you're suggesting, from person to person.
Now they come up with a new flu shot every year, isn't that correct?
That's absolutely true. So indeed, that's why we all need a flu shot or flu vaccine every year, because there's actually different strains of influenza that circle the whole globe every year. So our influenza season runs from the fall usually until mid-spring potentially here in Columbus. So every year, and this year we have 2 A strains and a B strain in the vaccine. I have my notes here. This year, it's actually an influenza with a subtype name of California. It actually is an H1N1, very similar, and actually it is almost identical to the virus that spread the globe back in 2009. It actually has a number associated with it. So that California strain is the H1N1 strain. There's another H3N2. These are just ways we label them. That strain is also a part of the vaccine. And then the final one is a B strain. It's named Wisconsin because that's where it was first isolated. Those are the 3 strains we anticipate this year. And in fact, the good news is that actually is what we're seeing both around the country, but here in Columbus, there's a very good match for this year between the influenza vaccine and actually the circulating viral strains that we're trying to protect. So the good news for us is that yes, your flu vaccine this year, sometimes we're better matched or not as well matched, but this is a good match. And again, there's lots of vaccine around. So if you haven't gotten your vaccine, we would encourage everybody, please, please, please get it to protect yourself, but protect others too.
When's the last time, that you should be able to get it and be protected from the flu? Is there a cutoff or a cap?
Well, we clearly are very actively immunizing into January, through January, into February, and frankly, it depends on the flu season. A flu shot usually takes about 10 days to 2 weeks for people to build up antibodies, and we know that our peak of influenza here is usually end of January and into February, even late February. So again, we're actually in our 2012-13 flu season. We've already in the fall seen a lot of illness. And that doesn't mean we may not even have a double dip this year. So we may still have another peak in January and February, late January and February. So again, I would strongly encourage people in January and February to seek out flu protection.
So you get your shot, and then after that, how many days or weeks is it before you actually have immunity?
Well, so again, it takes a while for the flu shot to allow us to all build up our antibodies. That's what protects us. So that probably is 10 days to 2 weeks for full protection. Actually, there's also a nasal virus, a nasal vaccine. It's a live virus as opposed to a killed virus in the flu shot. Actually, the nasal vaccine, again, is a live virus. Our body reacts more quickly. That actually probably starts to provide some level of protection right away. So there's some good news to that. That virus, or that vaccine, is really only available to those of us who are ages 2 to 49 and are healthy. The rest of us who are 6 months to many, many years, 99 and 100 plus. That's the vaccine for us, is to get the injectable. It's a killed vaccine, and so that too, it probably doesn't offer immediate protection, but again, the full protection wouldn't be anticipated until probably 10 days to 2 weeks, probably 2 weeks out.
And being that it's a killed virus, is it possible to get the flu from the flu shot?
So how many times do you get asked that, Dr. Keseg, and all of us? No, you can't get the flu. You will not get influenza from especially the flu shot. Now, you may have some reaction. We'll come back to that. But no, it's a killed vaccine. It's a killed virus. So no, you will not get influenza from a flu shot. Actually, interesting, on the nasal vaccine, it's a live virus. So in fact, we actually see a little bit more reactivity to that. You will not get the flu, the true influenza, from the live virus either. But indeed, we do see reactions on both sides. So what can most of us expect from a flu shot? Most people tell me they have no reaction. That's the good news. But some of us do get a sore arm. You know, you need to move it around a little bit. That's the trick that we try and share with people as far as when you get your flu shot. But indeed, you may have a reaction to it. It'll usually be very mild. You can have more than that. We can come to that. But again, very mild reactions. Some people do tell us stories about becoming ill after that, and likely they probably already had another respiratory virus or some other virus that has been incubating that they didn't know about. Nobody would have. And then they become ill and they say, I got the flu from the flu shot. Right. And just the other day, I had a neighbor tell me that they had a gastrointestinal infection right after getting the flu shot, and they'll never get the flu again. Like, that's totally different.
Right.
So it's a lot of stories. But again, most of us either have no reaction or a minor soreness. But indeed, from both the nasal and the other, you can get aches and pains. There's no doubt about it. And we can see some minor reactions from the nasal, and really more we would expect from that because it's a live vaccine.
So is there any age cutoff where you should not get the flu vaccine, like young or old?
So the clear recommendation is from 6 months until the end of our lifespan. So as one of our colleagues, an infectious disease leader here in Columbus and Franklin County says, if you have a pulse, you should get a flu shot. So again, we don't offer the vaccine for the very young, for the infants from 0 to 6 months. Anybody is encouraged and certainly eligible above that. Now, there are a few people that actually we would defer getting their flu vaccine, and those are really very few, but people who have true and serious allergies to eggs. If you have an allergy to egg, and I really mean that means you can't eat cake or bread, because there is egg in bread and cake. So if someone tells you that, or knows themselves that they really can't eat cake, they shouldn't get a flu vaccine if they know that the component to cake or to baked goods is from the egg.
So how about if you're pregnant? Is it okay to get the flu shot then?
It is okay to get the flu vaccine when you're pregnant, but they should work with their provider again. Actually, this last time, and you mentioned the H1N1 pandemic, we actually were strongly working with obstetricians in this community to see that women were protected, and we'd love to protect them in their second or third trimester as opposed to the first trimester. It just kind of depends on where they are in their pregnancy. But actually, we had one of those very sad situations with a pregnant woman actually getting exposed and actually becoming quite ill during her pregnancy.
Okay. So what if someone cannot afford to get a flu vaccine? Where could they go?
They can go to a variety of places. First of all, actually, many providers, and if they're already in a health, with a relationship with a physician, a nurse practitioner, they may well defer any kind of payment. But indeed, come to Columbus Public Health, or Franklin County Public Health. There are numerous places. They may also already be in a clinic setting. Our neighborhood health centers, and there's a group of community health centers, all of them will offer the vaccine, regardless of people's ability to pay. So hopefully that financial barrier is not a true barrier to people getting flu protection.
Thanks so much, Dr. Long. Our EMS providers within the Columbus Division of Fire are taking care of, on average, about 400 patients each and every day. So it's important for them to stay healthy so they can take care of you when you call. Now, if you do call 911, and you have flu-like symptoms, please make sure that you tell the 911 operator that you're having these symptoms, or tell the EMS personnel when they arrive so they can take the proper precautions. You may see them put a mask on themselves, or they might ask to put a mask on you, but that's just to prevent the spread of any flu virus to them. Many of them have had the flu shot, but it's important to be especially careful to not promote the spread of this flu virus. Now, where can you get your flu shot? Well, your doctor's office is a great start, and local pharmacies and clinics also offer immunizations. And sometimes even your workplace will offer the shots to you. Now, two other resources are the Columbus Public Health Department and the Adult Immunization Coalition of Central Ohio. Here's some healthy habits to remember during this flu season. Even when you're not sick, avoid close contact with sick people and wash your hands often. Try not to touch your eyes, nose, and mouth to decrease the spreading of the virus. And if you are sick, make sure and cover your mouth and nose with a tissue when you sneeze or cough. And stay home from school or work if you are ill. Another infectious disease, and one of the most deadly ones that we encounter in the field, is sepsis. Sepsis is basically defined as a potentially life-threatening complication of any infection. And while sepsis can happen to anyone, it's most common and most dangerous in people who are elderly or who have a weakened immune system. Sepsis occurs when chemicals released into the bloodstream to fight the infection trigger an inflammatory response throughout the body. This inflammatory response creates microscopic blood clots that can block nutrients and oxygen from reaching vital organs, causing them to fail. If sepsis progresses to septic shock, blood pressure drops dramatically and the person may die. One of our area fire chiefs, John Harris, who's the fire chief for Clinton Township, recently had an experience with sepsis that he will not soon forget. Chief Harris, on that night that you actually went to the hospital, what kind of symptoms had you been having prior to that?
All day long I was asleep, actually. Felt bad, felt like I had the worst case of the flu. There was really no nausea or no vomiting. I was just tired, very cold, and I slept all day. And my wife came home, found me that night, and she's like, "What's wrong with you?" And I said, "I don't know. I got food poisoning. I'm sick. I don't know." And she wanted to know if I wanted to eat, and I said, "No, I just want to sleep." And she got worried, and she said, "You need to go to the hospital."
Wow.
So she put me in the car and started to pull out of the driveway, and she said my breathing changed.
How did it change?
She said I acted like I was short of breath.
Okay.
So she called 911. Medics came and picked me up and took me to OSU.
And all this happened in the course of just one day with your symptoms?
Exactly. In fact, that morning I left a coffee shop and was on the way home. I was off that day on vacation and felt perfectly fine until after I left the coffee shop.
So you were taken to the hospital by squad,
Right.
and when you got there, what were some of the things that they were thinking in the emergency department that might be causing these kinds of symptoms?
They weren't sure exactly. And so they admitted me that night, and later on that night they moved me to a step-down unit.
Okay.
And then the following day, my breathing got even worse, and Dr. Jerry Tran, I'll never forget this as long as I live, came in the room and he said, we're going to have to intubate you or you're going to die.
So basically put you on a ventilator or
Right.
else you were going to die.
Right.
And what were your thoughts about that?
Didn't have much to think about on that.
Yeah.
You know, my wife was there and she's like, probably a good idea.
So they put you on a ventilator, and how long were you on the ventilator?
7 days.
7 days.
7 days in ICU.
And so then apparently things got better. They took you off the ventilator, and then what happened after that?
Well, it was a long road to recovery after that, because if you've been in bed immobile for that long, you lose all your strength. So I had absolutely no strength, couldn't even turn over in bed. So they sent me to rehab at Dodd Hall. I was there I was there for 6 weeks, I guess. And once while I was in Dodd Hall, I went into flash pulmonary edema, went back to OSU and was in ICU for a while.
So you actually had to go back to the hospital from
Right,
Dodd Hall.
right.
And when it was all said and done, what was the final idea as far as where this infection actually came from?
They said it could have been one of two things, either pneumonia or an infection in a calcium deposit that I had on my toe.
Okay. And we talked about this before off camera, you said they thought the bacteria was something called MRSA.
Right, in my toe, right.
And that's methicillin-resistant Staphylococcus aureus, which is a very prevalent bacteria out in the community now and a very, very dangerous one. So, anyway, so they thought it was from your big toe.
Exactly,
from a calcium
which wasn't
deposit.
even sore.
And you didn't have any symptoms from
No,
that at all.
No.
So really all this kind of just rose up very suddenly without any kind of warning signs that you might have been able to experience.
That's right, very quickly.
Okay. And now you're doing much better, I assume?
Yeah, I was on kidney dialysis for 4 months. Went to dialysis 3 times a day.
And again, another result of the sepsis.
Right, the sepsis
failure.
caused complete kidney failure, right.
Okay. Well, thank you so much for telling us your story here. And
But thanks for having me here. I'd like to get the word out to everybody that it's no joke. We need to fight it.
we're here with Dr. Eric Adkins, who's an assistant clinical professor here at The Ohio State University, and also is the lead administrator for the emergency department here, and has been working a lot with our sepsis program here with the Columbus Division of Fire. Dr. Adkins, can you tell us what is sepsis?
Yeah, sepsis is essentially a medical emergency. It's something that is often under-recognized by most providers, whether they're in the pre-hospital setting or in the hospital setting at times. It's really a response to an infection within the body, and where the body kind of has an inflammatory reaction to an infectious insult. Everybody's different, where some people's response becomes much more elevated or more aggressive, causing a number of other changes at the cellular and biochemical level, and there are other people that it may not be so severe. But in general, it's basically a response to a infection within the body.
And so this infection can actually be lethal?
Yeah, it can be lethal. Approximately, there's about 750,000 people a year that will be affected by severe sepsis. About 250,000 of them die. So it's a pretty significant mortality rate, and to get a better grasp of kind of what that means, that's about an event like September 11th happening once every 4 days.
Wow. So why is the mortality so high?
Part of the reason, I think, is that at times it may be under-recognized at the beginning. So, we know that things like early fluids, oxygen therapy to patients, and antibiotics can help with reducing their mortality rate. But even sometimes the best laid treatment and plans and early recognition it falls unfortunately to the patient's demise. So, part of it, I think, comes back to some of the personalized aspects of medicine, where each individual is unique and the body reacts differently from an inflammatory response, where it's trying to fight off the infection. So some people, their inflammatory responses may be exceedingly high, and they have a hard time kind of turning it off and making it come back to not affect other vital organs in the body. Okay,
so what you're saying is there's a time-critical element to the actual interventions that a patient with sepsis should receive.
Yeah, definitely. Sepsis should be thought of as a medical emergency, similar to things like stroke, heart attack, trauma.
Okay, so how prevalent is sepsis here in the Central Ohio community?
We see it all the time. I think it's out there a lot, but it's probably under-recognized by folks, and really to get to the point where I think we can do a better job at deciding on how much of it's out there is we have to just start thinking about it more often and kind of asking the question, could this patient have sepsis, when maybe it's not so obvious. It's other patients say, well, I have a headache, and they have their migraine or something like that, or they come and say, I'm having chest pain, or they're having slurred speech. Those types of signs and symptoms are very obvious. Patients with trauma are very easy to identify. They've come from a car accident. They have a gunshot wound to themselves. Sepsis is a little bit different, where it can be a bit indolent at the beginning, where it's not so obvious. It may be kind of low-grade fevers, just kind of feeling ill, confused, and it's part of getting people to realize that some of those kind of more vague symptoms at times put together, with other ones could potentially be sepsis.
And you mentioned trying to make equivalent sepsis with stroke and heart attack and things like that. Are you instituting a program for like a sepsis alert?
Yeah, So we have what's called it's exactly called that. It's a sepsis alert here at The Ohio State University Wexner Medical Center. And it will, we actually encourage the EMS providers to call it from the field. But anybody who walks into our emergency department who has certain signs or symptoms, such as elevated heart rate, elevated temperature, if we have those things kind of put together, we decide to activate the sepsis alert system here at the medical center.
And what does the sepsis alert actually get you in terms of resources?
So it should bring you nursing, obviously, to the bedside, senior physicians, so either one of our senior residents, second or third year, and then one of our attendings will come. They've been instrumental in helping get us to a shorter door to antibiotic time.
So do you have a time goal where you're trying to get your antibiotics started within a certain window of time?
So some of the surviving sepsis guidelines out there, suggest within 3 hours. My personal opinion is that we should be able to do this pretty quickly, and so it's my hope that we're starting to get people down into under an hour and even under 30 minutes. We've had some good cases so far with our sepsis alert system that we've actually been able to get antibiotic administration time started within 30 minutes. And I think if you look back at things like stroke, I can get you the CAT scanner within 15 to 25 minutes. I can get you to the OR if you have an injury, like a gunshot wound, within 5 to 10 minutes. I can get you to the cath lab, through the emergency department. And EMS providers actually can bypass, our emergency department to go straight to the cath lab. And so metrics like that make me think that we should be able to provide antibiotics to patients that we think have sepsis very quickly, and hopefully within 15 to 30 minutes.
So the EMS providers are a critical component of your early detection system here.
Oh, definitely. EMS providers are key. They're the front line to every patient that we get to see. And we're interested in having these types of patients come to us at the Wexner Medical Center. We feel like we can provide an improved service to them, and we hope that they'll continue to kind of recognize this and bring them to us and realize that we're going to be here waiting to take care of those patients.
And to facilitate their evaluation in the field, the Ohio State University and the Wexner Medical Center has provided to our EMS providers a device called a lactate monitor. Can you tell us a little bit about that?
Yeah, it was a unique opportunity where we were able to invest some money in the meters and put these in the hands of EMS personnel. So anytime that patients get significantly sick and they get low blood pressure or hypotensive with severe sepsis or septic shock, then we expect that their lactate goes up. There is a subset of patients that will have severe sepsis or even progress to septic shock that will have normal lactates initially, but the lactate meter will help serve as a tool that can try to help screen and identify patients that may have sepsis. Even if their lactate level is normal, though, we still want the EMS provider to feel comfortable saying, I think this patient could still have sepsis, and call ahead to provide us with information that would suggest that there's a sepsis alert that we can activate from the field.
And are there other sepsis programs around the country that are doing some things that are similar to what we're doing here in Central Ohio?
Yeah. I mean, I think there are a couple out there, but what we're doing here is still, we're in the unique group of people that are, I think, trying to help advance the care of these sepsis patients in the pre-hospital setting.
And of course, we're primarily interested in the outcome for the patients being good, but along with that, you have to take into account the cost of the care. And I imagine the early treatment actually reduces the cost of the care for the patient.
Yeah, definitely.
So, we've been able to look at two very different infectious diseases. With the flu, we have the ability to protect ourselves from getting it through the influenza vaccinations. With sepsis, if we are unfortunate enough to contract that, like Fire Chief John Harris, it's good to know that our EMS providers have the necessary diagnostic tools and interventions to afford those patients the very best possible outcomes. This has been another episode of EMS Perspectives, and as your host, and on behalf of Fire Chief Greg Paxton, and for the Columbus Division of Fire, this is Dr. David Keseg wishing you a safe today and a healthy tomorrow.